Hello, this is Hilary Longhurst, and I'm delighted to be able to present this talk about hereditary angioedema and women as part of the HAE UK 10th anniversary celebrations. Now, this talk really should be about HAE and families because of women, of course, traditionally are concerned maybe less with themselves, but with the wider family, particularly their children, but also the older people and the wider society. And sometimes this means that we as women don't put our own needs first and maybe don't put our own health first. And it's very important that we get over that and that we do ensure that we're healthy and well, so that, of course, we can take our responsibilities towards our families and wider society. Now, one of the things about the 21st century is that men are now increasingly able to have the privilege of looking after their children and looking after their family and sharing these duties with women who, of course, are increasingly going out to work and earning a living and sharing those duties with the men in their family. So this talk is very much about HAE and families. There are slides specific to women, but since HAE is a family problem, it's very important that we all understand how we ourselves and our family members can best keep healthy. So if you're a man, please do listen to this talk as well. So I'm going to talk about I was going to say the 7 ages of man, but it looks as if it's about the 11 ages of women. But as I said, very important for everyone to understand. And much of the material I'm talking about is very applicable to everyone. So I'm going to start at the start of life. And as a parent, of course, one of your main priorities is your children. And childhood is a time when you are setting your patterns for the future. Do you expect to be a confident and prosperous and healthy person, or are you expecting to live with huge limitations? Now, as a parent, it's very, very important that you bring up your children to be confident, to understand the challenges that they might face in future, particularly if they have hereditary angioedema, and with your doctors to give your children the means to deal with these challenges. Now, before puberty, we know that children often don't have too many HAE-related symptoms, but now is the time that you need to start educating them as to how to handle the future. Because when they enter puberty, as many of us parents know, it's a time of experimentation, of rebellion, and of really moving from childhood to adulthood. And all those things you've learnt before you get into puberty, you're going to take forward and you're going to really set your pattern for the future. If you're a girl, as well as the problems of stress, challenges, worry, fatigue, getting out, rebellion, all that stuff, you've got estrogens to cope with, which, as we all know, can lower the threshold for having HAE attacks. Now, slide 5 shows my preferred treatment options for teenage girls and for young women. Of course, we've had huge progress in treatment and preventative treatments in particular recently, so it may well be that many of these are superseded. But what I will say, in preventing attacks, it's very important to avoid estrogen-containing medications as far as possible, but progesterone-containing medications, particularly the mini pill for contraception, and the morning after pill, should that ever be needed, are absolutely fine. And in people who have infrequent attacks, and in many people, can often reduce the frequency of attacks. Now, our mainstay of treatment, of course, for acute attacks is still intravenous C1 inhibitor. But of course, for many or maybe most of us, icatibant giving subcutaneously is a much simpler and easier to administer option. Nevertheless, It's a very helpful thing to be able to self-administer C1 inhibitor, and children can be taught from the age of 8, but most commonly they get taught in their early teens, ideally before adolescence kicks in. And this is just a picture of one of our patients taken several years ago and her family learning how to give intravenous C1 inhibitor under the care of John Dempster. Now, many women, of course, will want to have children, and if you have HAE and you're pregnant, then C1 inhibitor, which can be given subcutaneously for prevention, hopefully available in the UK in future, or intravenously for treatment, is the best and safest option. It's good to prepare in advance for pregnancy because many prophylactic medications need to be stopped, sometimes quite a few months in advance. So you'll need to prepare for how you're going to deal with things should you have more attacks when you're trying for pregnancy or during the pregnancy itself. And as well as stopping prophylaxis, which of course can result in you having more attacks, pregnancy itself can increase the number of attacks people have in some cases, or it can decrease the number of attacks you can have, or indeed no change. But certainly many people do notice that things change, so it's good to be prepared for that. Now, we know that pregnancy can also be quite a stressful time. Many people find it difficult to get pregnant, and many pregnancies, at least a fifth to a quarter of pregnancies end in miscarriage or abortion. And so it's obviously important to maximise one's health during that time. And as I said, the best way to do this is by having access to C1 inhibitor treatment whenever you need it. This slide showed some recent pregnancy data which suggests that pregnancy outcomes and complications are broadly similar in hereditary angioedema as to the rest of the population, which of course is very good news. However, it's still important to treat those attacks early with C1 inhibitor and generally maintain good HAE health. The other thing I should say about pregnancy is that in the UK it's possible to get assisted conception and embryo selection if you want to make sure that your child will not inherit hereditary angioedema. If you're breastfeeding, it's better to avoid androgens, although recently I've heard of a lady in India who successfully took androgens throughout breastfeeding her baby without any problem for mother or baby. And then finally, the menopause. Of course, as women, we're going to spend about half of our lives after the menopause, so very important to know that attacks generally will get better, but of course may get worse, particularly during the menopause itself. Very important to avoid estrogen replacement therapy, but there is an old-fashioned hormone replacement therapy which works very well for hot flushes called Tibolone, which also has been shown to reduce HAE attacks. And then in old age in general, it's safe to continue HAE medications for the vast majority of people, but there are certain blood pressure drugs, ACE inhibitors, which should be avoided, that are quite commonly used. So very important for all of us, male or female, to look after the women in our families and our wider families. So I hope this talk has been helpful and look forward to seeing people soon.